So good morning and welcome to our third installment of our webinar series for February. I'm Leslie and I'm joined by my colleague and peer, Alessia, and we are here from Adler Community Health Services as part of the Providence Health Wellness team to talk about understanding neurodiversity today. As we move through the presentation today, I'm going to click. There we go. So this is our brief agenda for the day. So we're going to review the terms associated with neurodiversity, and then we're going to talk about caring for patients specifically with neurodivergence. So we're going to look at ADHD, the autism spectrum, the fetal alcohol spectrum, and then talk about executive dysfunction as a whole. And then we'll end off with some additional resources to just support your understanding of folks that are neurodiverse, as well as options for questions and a quick little survey on your experience in the webinar today. So we'll jump right in and okay. So let's start by understanding the terms associated with neurodiversity. So when we're talking about folks that are neurodiverse, we're really talking about the diversity or the variation of cognitive functioning that individuals present with. And so understanding neurodiversity provides us sort of a template to enhance our education and just to understand how to support folks with differing abilities. And oftentimes with neurodiversity, these abilities can be invisible, and so they're not as obvious as physical disabilities. And so we don't tend to maybe think or kind of bring them into our consciousness as much when working with patients. And really what we're talking about here is just the actual normal variation that happens in our human genetic code. And that's what leads us to folks that are neurodivergent. So we're really talking about cognitive functioning here that's not considered typical. And as I mentioned, we are talking about specific presentations of that today. So we will talk about autism, ADHD, and FASD, but this also includes a wider umbrella like learning disabilities as well, and other developmental conditions. But we will be focusing on a specific subset of conditions today. Okay, so why? Why are we asking you to learn about this? Folks that are neuroatypical or neurodiverse can often present as behavioral challenges, especially in the hospital setting, which is an anxiety-provoking setting for many of these individuals. And so really what our aim is to help you as healthcare professionals just to have a better understanding of the unique needs of this special population and sort of just have some knowledge in your back pocket in a toolbox so that you can make interactions more seamless and more beneficial for the patient in delivering really good standard of care. So about 30 to 40% of the general population are thought to be neurodivergent. So this is a big number. So it's not like you're not going to see one of these individuals in your care, in your practice, in your lifetime. You absolutely will. So it's important to have knowledge of how we can best support these individuals. Another reason why it's important is, again, when we think about that behavioral component, these are individuals that have a different way of thinking and perceiving the world and then interacting with the world around them. And so having a little bit of knowledge of these differences or these uniquenesses can support our patient care overall. Also embraces inclusivity. And so making hospital-based settings, making the workplace even. So this also isn't just about patients, right? Your coworkers might present with some of these issues or challenges as well. So it's about making the environment more inclusive, more supportive, and more safe for both yourselves and the patients overall. And so that's really why we're here today to present some of this information to you. And I'm going to pass it over to Alessia now, who's going to talk to us about attention deficits.
Okay, so yeah, I'm going to be talking to you today about ADHD. So ADHD was originally thought to be just a childhood condition that kind of people would grow out of in adulthood. But we now know that it is a developmental neurological condition that affects both children and adults. And so the main features of ADHD are inattention, hyperactivity, and impulsivity. But there are other areas that ADHD affects, and we'll be touching on those a little bit more as we go along. But really, ADHD can affect an individual in multiple areas of their life, not just school or work. And so you will likely see ADHD impacting patients in the healthcare setting. It's been estimated to affect 9% of children and between 2.5 to 5% of the adult population. However, a lot of adults nowadays are actually getting tested and diagnosed. And so I think that that prevalence is probably going to increase in the coming years. So you will likely encounter this at work. So what are some common symptoms to look out for? The first one, like I mentioned, is difficulty regulating attention. And so I think the common notion is that ADHD is a disorder of attention and that people with ADHD struggle to focus. But really what the thing is that people with ADHD kind of fluctuate between focus and hyperfocus. They struggle to regulate their attention. And this is because people with ADHD have an interest-based nervous system. So what they're paying attention to are things that they are interested in, things that are more urgent or pressing. And so this kind of veers their attention in one way or another. So what can happen is that they avoid or dislike work that requires sustained mental effort. And so you might see procrastination, difficulty getting started on tasks. Disorganization is a big feature of ADHD. So difficulty keeping the home clean, keeping track of belongings, remembering appointments. So this might be actually pertinent, and staying on top of important tasks. So this could be a big task like renewing a driver's license every few years, or it could be a daily task like remembering to take medication. And that kind of goes along with forgetfulness as well. Secondly, we see hyperactivity. So hyperactivity, we tend to picture a school-aged kid kind of running around, disturbing others. But what ends up happening in adulthood is it kind of shifts. So one of the things we could see is fidgetiness or restlessness. So kind of touching things or getting out of the chair, or kind of, let's say, shaking the leg up and down in the chair. Chattiness, so talking a lot or not knowing when to stop talking. And then there's this internal restlessness, which can look like racing thoughts or distractibility, and sometimes impatience. And impatience and impulsivity go hand in hand as well. And so impulsivity, you might see a person interrupting a lot during conversations, difficulty waiting their turn, speaking or acting without thinking, which can cause a lot of interpersonal problems and can lead to accidents and injuries. We'll talk about that a little bit more in a bit. And so then the two things that I haven't mentioned yet are executive functioning and emotion regulation difficulties. Executive functioning, we have a few slides just on that at the end, but the main things with executive functioning and ADHD are one, remembering multi-step instructions, doing tasks that have multiple steps, difficulty transitioning between people, places, plans, or demands. So let's say a person is in the middle of completing one task, they have to stop that task and leave to go to an appointment. They might get too caught up in it and not be able to kind of change and be on time for that appointment. And then difficulty monitoring behavior and tasks. So monitoring behavior would be understanding how you appear to others, and monitoring tasks would be making sure that you're doing the task properly without making mistakes. And then emotion regulation difficulties. So this is thought to be one of the more impairing features of ADHD for adults. It really impacts all areas of life and impacts relationships. So people with ADHD are thought to be more sensitive to rejection, in that they perceive certain comments or actions as maybe being more offensive or taking more offense to these things. And so these small things can lead to big emotions. And in the same vein, small frustrations can lead to a lot of overwhelm and then difficulty calming down after the person becomes overwhelmed. In the long term, this can lead to a variety of difficulties, including mental health and health concerns, difficulty with relationships, and the list kind of goes on. So we'll talk about these co-occurring conditions. These are just some of them, and I think that a lot of these can impact what you might see in the healthcare setting. So one big one is substance use. Substance use is related to, one, impulsivity, and two, emotion regulation. So these folks struggle to regulate their emotions, and then will often turn to substances to help them with that. Secondly, relationship difficulties. So folks with ADHD are thought to have more marital discord, more arguments, and even discord with their peers, which could lead to a sense of failed relationships, which then can lead to loneliness. Learning difficulties. So people with ADHD there is a correlation between learning difficulties, for example, dyslexia and ADHD, anxiety and depression. So there's a kind of lifelong pattern of failed tasks and disappointments, and this leads to depression and feeling hopeless, and also anxiety about the future and being able to succeed. And then increased injuries. So folks with ADHD tend to be more adrenaline seeking. And so this can lead to you maybe seeing ski accidents, rock climbing accidents, and also the impulsivity and the distractibility can lead to more car accidents. And then disordered eating. And so this kind of is associated with the forgetfulness. So forgetting to eat in regular intervals, and then binge eating at the end of the day, and maybe not eating so healthy either. So I kind of already touched on this, but with ADHD and hospital visits, there's a bunch of things you might be seeing. Individuals with ADHD experience on average a higher frequency of hospital visits. And some of the common health issues you might notice are binge eating, neglecting exercise, forgetting important medication, higher frequency of motor vehicle accidents, unintentional injuries or trauma. And then more recently, some research has come out on COVID-19. Folks with ADHD are more likely to get COVID-19. This has to do with impulsivity and kind of fidgetiness. So fidgeting with the mask, impulsively kind of going to hug or touch other people. So those kinds of things. So how to care for patients with attention deficits. I think patience is really big here. So remembering that these folks have struggled their entire lives with judgment from others, with how they might seem to others. And so compassion and patience will be really important. So this can look like communicating information slowly and in multiple steps. And you might have to repeat information, and even checking in to make sure that they've understood everything, because there can be a lot of shame with feeling like you've gotten distracted and then not followed what the person was saying. And so asking them, do you understand? Do you need me to repeat that? That might be helpful. Expecting forgetfulness. So they might forget an appointment or forget to take medications. So if there's a way to help them set up reminders for appointments or reminders to take medications, that could be a huge help. Expecting fidgetiness. So this doesn't mean that they're not paying attention. Rather, this is actually helping them regulate their attention. So yeah, just to expect that. Individuals with ADHD need advanced preparations for transitions. So when possible, giving warnings if they have to change rooms, if there's a new schedule or medication that they have to take, just kind of following up. It might take a few tries for them to get it right, but eventually they will. And then individuals with ADHD might have trouble completing paperwork, so missing steps, taking longer than maybe you would expect. So if they miss sections, just kind of follow up with them gently and help them fill it out.
Yeah. All right, so we'll jump from ADHD to ASD. So autism spectrum disorder really is characterized by a broad range of conditions, and we're seeing deficits or difficulties in several areas. So we see them most often in social skills, but also with speech and nonverbal communication, and then repetitive behaviors. So again, autism, not just a childhood developmental disorder, it's neurodevelopmental, so it's pervasive and it doesn't go away. So again, you will be seeing adult patients as well that present on the spectrum. ASD occurs in all racial, ethnic, and socioeconomic groups. Its prevalence is more common in boys than among girls. However, that's also likely an underestimate, just because girls with ASD actually tend to be more undiagnosed because they present differently, and with boys it's a little bit more overt, but there does just seem to be a trend in terms of gender. And so, you know, why are we talking to you about ASD? Well, there's lots of co-occurring conditions and difficulties that these folks present with. So we'll talk a lot about sensory sensitivities and other medical issues, in particular GI disorders, seizures and sleep issues, and then other mental health challenges such as anxiety and depression, as well as attentional issues. So you'll see that we've kind of structured today with ADHD first, because although that can be its own disorder independent of other things, both autism and FASD also present with attentional issues. So it's important to consider some of those pieces that Alessia just mentioned, as well as we move through with the other disorders that we'll be chatting about today. ASD is appropriately named as a spectrum disorder because it is a very wide spectrum. So you're going to see a huge shift in abilities, you know, low levels with significant impairments, significant communication impairment, motor difficulties, all the way up to really highly skilled. We can see savants on the higher end of the spectrum, very bright intellectual folks. So that the spectrum word in this disorder title is quite important to take note of, because you will see a wide range of abilities. So let's talk a little bit about some of the co-occurring conditions here. GI issues. So again, sort of a spectrum. So we see the chronic constipation and or diarrhea. So actually about 47% of adults and 45% of children with autism do have GI symptoms. Diarrhea is the most common, followed by abdominal pain and constipation. So just that's, you know, one of the reasons why these folks may end up in your care or your treatment or hospital. GI issues are a place of major concern. IQ concerns are likely what is not bringing them into the hospital. However, important to consider when we talk about communication and the delivery of information. And we're going to talk about that a little bit more specifically shortly. Low muscle tone. So folks with ASD tend to have moderate to severe loss of muscle tone, which limits the development of both their gross and fine motor skills. So again, some folks with ASD, you will see the motor issues quite overtly. It'll be quite obvious. Some will be less obvious. You know, kind of to just tailor on from what Alessia was mentioning about paperwork with ADHD. With fine motor skills, that can be quite cumbersome for folks that have difficulty with fine motor and writing and output in that way. So just something to consider in terms of the speed, efficiency, or even legibility of filling out paperwork. Pain. Another spectrum here. So high pain thresholds where no pain is experienced for something that we would expect pain to be experienced for in terms of procedures, versus low pain thresholds, you know, feeling everything, and everything's painful. Touch is painful. So just consideration of that. Pica. So pica connects back to the GI issues. So this is a compulsive eating disorder that's characterized by eating non-food items, which can lead to choking, other digestive problems, infections, and just other illnesses as a whole. So things I've seen in my practice in terms of non-food are like paper towels or balls of hair or lint, dirt or sand. So you can see where some of these infections and other illnesses may come from. So again, they might not be coming in for the pica, but a reason why, you know, there's a connection to the ASD piece there, and some of these other problems might show up. And then seizures. So approximately 30% of folks with autism develop epilepsy. So another thing to consider when working with folks that are seizure prone or have a seizure disorder, you know, there might be some underlying spectrum piece there as well. And we'll talk a little bit about how to support these folks in the hospital-based setting, you know, if they're getting scans or if they're having to be hooked up to various machines with different noises, et cetera, and how to keep their comfort levels just so that they feel comfortable during the procedure. Okay, so ASD and hospital visits. So similar to the data that we have with ADHD, we're seeing a similar trend. So emergency department visits for adults with autism are 2.3 times higher than adults without ASD. This is from a meta-analysis done in 2016. And so they found that, yeah, these folks are attending hospital more than folks without ASD. And challenges in the hospital-based setting, first and foremost, include challenges with communication, challenges with making healthcare decisions as a whole, overstimulation due to the sensory sensitivities and all of the lights and sounds that are in a hospital-based setting. And then lastly, the gap that we're trying to fill is the lack of ASD-specific training for healthcare providers. So these are some of the challenges that we see with folks attending the hospital that present on the spectrum. Okay. So things you might pick up on. Again, you're going to see another similar comment here to our ADHD piece, but patients on the spectrum tend to make repetitive motions, and this is known as stimming. So you might see flapping, which is kind of back and forth of hand movements, kind of stretching of fingers like this. Rocking is a big one, particularly for adults. You'll see more rocking, it could be back and forth, or pacing in the room. View this as a coping mechanism in the same way that Alessia was saying with fidgetiness in ADHD as a way to regulate their attention. This is viewed as a coping mechanism to decrease some of the distress and anxiety associated with medical visits. Similarly, let's not assume that a patient is inattentive just because they're fidgeting or avoiding eye contact with you. Eye contact in ASD is already a challenge, so you will probably notice that there's not a lot of sustained eye contact. It can be brief or non-existent. This is not an individual being disrespectful or rude. This is merely part of their presentation and a way to kind of mitigate the discomfort in the healthcare setting. Connecting back to the IQ piece. So although they might not present hospital-based because of an IQ challenge, many folks with ASD do have difficulty processing information quickly or communicating in real time. So we really want to kind of give bite-sized chunks of information and ensure comprehension before we keep moving on with information or delivery of instructions. And the way to do that is just kind of pacing yourself and checking in to make sure that comprehension, that they understand what's being communicated. So what to do as a healthcare provider if your patient does become distressed? We want to give physical space with the consideration of safety. So kind of just letting the patient have space to cool down if they're becoming overwhelmed. Using minimal speech, so not giving too much instruction at one time, and at the same time as well, providing very clear and simple directions for whatever desired behavior you're looking for. Offer choices. So instead of keeping it kind of a wide open range of options, provide 2 to 3 choices so folks with that present on the spectrum have some autonomy in their own decision making, but also you're sort of guiding without them becoming overwhelmed with the amount of information presented. And then lastly, with sensory, which we're going to touch on a little bit more, is limiting bright lights and loud noises in the room or the area that you're in to the best of your ability. Now, we recognize that, you know, it's not always a picture perfect setting where you can control lights or control sounds, but to the best of your ability, just keeping that into consideration. It's something that seems very simple to us, but can have a major impact to the patient that you're serving. So let's just get a little bit more specific here. About ways that we can care for folks on the autism spectrum. So tapping into the communication piece again, using very literal and direct language. Let's avoid using figurative expressions and figures of speech. So we want to be as concrete and direct as possible about looking for examples of the types of symptoms that people experience, and also being able to direct the patient to very detailed information or resources about their health conditions. We want to support information delivery in two ways. So yes, we give the auditory piece, we do the talk piece, but let's also give a written handout or pamphlet, or be able to refer them to a website or something where they can gain more information. That way we're really supporting their comprehension of what we're trying to communicate. Sensory is probably the biggest one that we can support in the healthcare setting. So we want to avoid any unnecessary touching of the patient, dimming the lights, and using a quiet room, again, to the best of our ability. Body awareness in these folks may differ. So you might get people that are very in tune to their body and their experience, and you might get people that don't understand that and have difficulty really kind of landing on where the symptoms are and what part of the body they may be experiencing them in. So just consideration of providing full explanations of what you're about to do, and also demonstrations, particularly for procedures. Giving a demonstration of what's going to happen next really prepares that person and allows them to have, again, some autonomy and understanding of what's going on in terms of their physical well-being. So keep in mind that, in the hospital, we've got lots of fluorescent lights, flickering lights at times. We've got lots of codes going off. We can have alarms going off. These are all things that are going to drive up anxiety and drive up distress for folks that are on the spectrum. So that's kind of the auditory piece and the visual piece. There's also a tactile piece here. So being aware of how sheets or certain areas that they're sitting on may affect them. Sometimes there's certain fabrics that these folks just might find intolerable. So just having an awareness of that and a sensitivity to that. And then the last component here is planning and organizing. Again, we're landing in that executive dysfunction realm. Executive dysfunction is kind of the commonality between all of these disorders. So again, we want to be as consistent as possible. Folks on the spectrum love structure and love repetition. They thrive in those kinds of settings. So consistency in terms of appointment bookings to the best of the ability, and routine for what's occurring during the medical visit. So if it's kind of a routine visit, let's keep the steps all the same, so those folks already know what's about to come next and there's no difficulties with switching there. And again, we want the visual cues with auditory information. So that might be pamphlets of information or reminders of appointments ahead of time, either by a phone call or maybe a written card, or helping that person put it in their calendar, whatever they need to kind of support their hospital visit. Okay, so that's the ASD portion. So now we'll jump into our next acronym of FASD. So now we're talking about folks with acquired brain injuries. So folks that are on the fetal alcohol spectrum or presenting with fetal alcohol effects. We're kind of combining the two for the purpose of this talk today. So FASD, really, we're going to see the most impact to the nervous system. And this has kind of secondary impacts to our adaptive functioning, our daily living skills, attention, cognition, executive functioning, and memory. So a lot of the same components that we've already touched on today. Folks with FASD have a lot of trouble with abstract reasoning, organization, and planning. Another kind of unique difference for folks with FASD is difficulty with sequencing. So understanding and recalling a sequence of events, and you can see how this will play into any type of procedure or examination that you're doing, like what's going on. We just did this, where are we at? Getting lost in the sequence of what's happening at the hospital visit. Connecting cause and effect relationships. So this is something where if you're trying to, connect that smoking increases the likelihood of several other medical problems, cause and effect relationships are difficult for folks with FASD. So just having some compassion for that difficulty. And then of course, regulation of own behavior. So these are folks that can become really behaviorally dysregulated and become quite easily distressed with lots of sensory sensitivities that are going on for them. Other things you might see with FASD is something that we call dysmaturity. So this is kind of a wide variety of maturity levels in one interaction. So it might quite flip-flop based on the information that's being delivered. So I share this in hope that we can work on kind of maintaining our own frustration tolerance when interacting with patients on the fetal alcohol spectrum, and understanding that this is part of the presentation. The maturity kind of can wax and wane throughout an interaction. Similar to ADHD, you're going to see things like poor judgment and impulsivity, which again may lead to an increase in hospital visits based on choices they're making in their communities. You're going to see difficulty with processing information as well. So being mindful about how we are delivering information and kind of the speed at which we're delivering and the words that we're choosing to deliver. And similar again to ADHD, this difficulty shifting between contexts. So moving from one procedure to the next, or one room or one area of the hospital to the next, that may cause some discomfort or some distress for these folks. And then lastly, again, we're having those nonverbal communication difficulties and difficulties with social cues. So don't rely just on your nonverbal to communicate here. We really want to be clear and concise with our language as well. So CAMH in 2016 did a meta-analysis looking at co-occurring disorders with FASD, and I will not list them all because they found over 400. So lots of co-occurring disorders with FASD, lots of impact from the alcohol while that individual was in utero. Most importantly though, or the most prevalent, I should say, are communication disorders, which is absolutely going to impact your interaction in the hospital-based setting, developmental and cognitive disorders as well, so IQ levels as well, and then again, good old attention and impulsivity problems. So you can see why we have ADHD first here, because it's also a part of these other disorders as well. Most common reasons for hospitalizations for folks with FASD are nervous system diseases. And the 5 comorbid conditions with the highest prevalence rates are abnormal results of the peripheral nervous system and using special senses. So conduct disorder as well. So there you're going to see impulsivity, behavioral challenges, receptive and expressive language disorders. So there's the communication popping up. And I won't dare try to pronounce that, but chronic ear infections is otitis media. So that's the ear infection piece. So lots of presentation to the hospital for that. Most commonly in kids with FASD, but also still occurs into adulthood. So something to be aware of. Okay. So what can we do? How can we care for these patients, given that they can present as quite challenging to interact with? So similar to ASD, we really want to use very brief, understandable language, and we want to really state clearly the behavior that we wanted. So whatever we want from them, state that clearly and give them short instructions of how to kind of get to that desired behavior. Using short questions and being very detailed with the questions. So very specific, providing lots of information. Let's remember that these folks struggle with abstract and conceptual reasoning, so we want to be very direct and concrete as we can. Do your best to avoid arguments or negotiations. We want to try again to be as calm, cool, and collected, noticing that when we elevate in terms of our frustration, that's going to elevate the person we're interacting with. So to keep that frustration at bay, we want to try and do our best to avoid argument. Again, expecting changes in the maturity levels throughout the meeting. So when we can expect that these difficulties might present, we can be better prepared for interaction. So expect for those changes, that dysmaturity to pop up during whatever procedure or even the interview, kind of portion of your interaction. You might sit with an individual and have a very adult conversation, but when you go to draw blood work, for example, you might get a more childlike presentation there. So just to be aware of that. Being non-judgmental. So this is really about noticing your own biases or stigmas or your own stereotyping that might be impacting your ability to give the best ethical care that you can for this individual. Recognizing that these folks might be a little bit more challenging to deal with, especially in a setting that will spike anxiety levels, spike distress levels, spike discomfort. So just recognizing how that's impacting your interaction with that individual. And having manageable expectations for their behavior. So expect these challenges in managing your own frustration. And that's again coming from attending the talk and learning some more about this presentation and ways that you can support these folks in the hospital, and also just having a little bit more patience in understanding that as frustrating as it might be for you, this is actually a very distressing interaction for them and could be very triggering to be in the hospital-based setting. So having an awareness of that can impact the way that we deliver patient care.
Okay, so I'm gonna kind of summarize the talk by talking about executive functioning. Like Leslie mentioned, executive functioning kind of underlies um, neurodiversity in general. Um, and so I think it's important to discuss when we're talking about neurodiversity. So what is executive functioning? The frontal lobe of our brain is what is in charge of carrying out the executive functions. It's the part of the brain that's in charge of helping us complete tasks and interact with others. So what does this include? It includes planning and organization, working memory, which is, it's kind of like a temporary sticky note in the brain. It's a skill that lets us work with information without losing track of what we're doing. Initiation and completion of tasks, self-monitoring of behavior, seeing how we're perceived, and of tasks, completing a task effectively, behavioral inhibition, so stopping ourselves from acting impulsively or saying something impulsively, and shifting. We've mentioned that a few times already. So like I mentioned, this underlies neurodivergence. However, executive functioning can also be negatively impacted by other conditions. So what's happening is that with these other conditions, the frontal lobe of the brain isn't working as efficiently because the body is either under stress. And so essentially the body's in a fight or flight mode perpetually. And so it shuts off that part of the brain. This is kind of an evolutionary adaptation in order to attend to the more pressing issues. So what these issues could be are psychological disorders like anxiety, depression, OCD, bipolar disorder, schizophrenia, and Alzheimer's. Psychological trauma, so more of an acute PTSD or complex lifelong trauma. Life stressors. So I think that most people have experienced executive dysfunction at some point when under extreme stress. So if you think back on really stressful times in your life, you might have had difficulty getting started on tasks, making decisions, remembering information, or maybe getting distracted during conversations, following through with plans. That's executive dysfunction. And again, that's because your body is paying attention to the more pressing needs, which is essentially keeping you safe and regulating your emotions. And then health conditions can also impact executive functioning. So if you encounter this either with a person who is neurodivergent or someone who's maybe just undergoing something really stressful or struggling with another mental health condition, how can you help? We've touched on these already, but this will be kind of a summary. So one of the big things you can do, if possible, is provide written instructions. This could be for medications. This could be for following through with procedures, maybe wound care, for example. And if diagnosing someone with a new disorder, a new health condition, if possible, providing a handout, a link to a video, something that they can review multiple times and use to kind of learn more about it in their own time. Check that information has been understood. So repeat if necessary. Provide reminders for appointments and medications. We've discussed this already. And helping the client use tools that they already use. Some things work really well for some people that don't work well for others. So it's likely that these folks have tried different things before and that the tools that they're using, they know help, or maybe introducing them to new tools if maybe they don't have any. And giving warnings ahead of time for changes in environment or a daily schedule. And like I've mentioned, there might be difficulty remembering change at first. And so practice is key and reminders are key at first. After a while, when it becomes routine, the executive functions aren't as involved. And so it's a little bit easier after a while. So it might be too that it's not just in your patients that you're seeing executive functioning and difficulties with any of the struggles we've mentioned previously. And so we've attached some additional resources if you wanted to kind of look this up on your own time and just to reference. And these are some really great resources. So the Canadian ADHD Resource Alliance, CADRA, got Autism BC, the CADAC site, Center for ADHD Awareness Canada, and the FASD Society for BC. So at this point, here are references, and we'll be taking any questions in the chat. We're also going to attach a survey to, if you could kindly fill that out for us, for how you felt the presentation went. So I'm going to add that into the chat now, and we'll be sticking around for another 10 minutes to see if anyone has questions.